everyone. Our group would like to represent on bioprosthetic heart valve. First question is, what is calcification? Calcification is a recurrent problem in patients suffering from heart valve disease, and it is the main cause of failure in biological heart valve prosthesis. Classification development. Classification development can impair valve leaflet motion and induce tearing, which resulting in stenosis and regurgitation and necessitating valve replacement. Next, we compare the classification and the normal heart valve. On the left side of the picture is calcified aortic heart valve. As you can see, calcium deposit on each of the three heart valves flaps. On the right side is the picture of normal aortic valve and triscopic valve. These valves do not have any form of disease such as calcification, prolapse, and infection. Lastly, transformation of calcification. The occurrence of calcification requires energy to achieve the phase transformation from solution to solid crystal, and the energy required can be decreased by the presence of nucleation sites such as surface defects, dead cell residues, collagen fibrils, elastin, lipids, and certain bone regulatory proteins which serve as a substrate for heterogeneous calcification in heart valve.
For questions number 2, suggest and describe at least 3 approaches to overcome this problem. Number 1, aminoolic acid binds due to a stiff base reaction to free aldehyde groups of tissue-bound glutaraldehyde. By either decreasing or inhibiting free aldehyde residues, the importance of AOA binding on biological tissues was determined. For number 2, decellularization by removing ulcers from tissues will make the bioprosthetic matrix less susceptible to calcification. This process was usually done after the mineralization process. For the number 3, target the free aldehydes present in bioprosthetic tissue. Tissue shows significantly reduced levels of calcium content and mineralization. Stiff base effectively neutralizing the aldehydes present can be produced by combining reducing substances such as glycine, glutamate, and sodium bisulfite.
Medical device categorization. Medical device shall be categorized according to the nature and the duration of the body contact. For bioprosthetic heart valve, it is under the implant medical device that is used for heart valve replacement surgery. Nature body contact is blood. Medical device principally contacting circulating blood in the cardiovascular system. Contact duration is about 12 to 15 years before structural deterioration. Next, there are few biological evaluation, and first of all is hemocompatibility. Hemocompatibility is the compatibility of a material with blood. It is essential for evaluating the interactions of medical device having contact with blood. Hemocompatibility can influence inflammatory process. It is conducted in accordance with ISO 10993 Part 4. Sensitization. Sensitization is used to estimate the potential for contact sensitization by medical device. These tests are crucial because repeated exposure can result in allergic reactions. It is conducted in accordance with ISO 10993 Part 10.
For the implantation test, it is applied in biomedical test to assess the local pathological effect on living tissue of a sample of a material that is implanted into an implant site or tissue for suitable biomaterial or medical devices intended application. This test was undergo at both a gross and microscopic level, where the local pathogenic effects will be evaluated. This test was conducted in accordance with ISO 10993 Part 6. For the carcinogenicity test, it is used to determine the tumorigenic potential of medical devices, materials, and/or the extract from either single or multiple exposures or contacts. It is appropriate if there is no any significant cancer risk, thus making this test is very rare to be done. It is carried out in accordance with ISO 10993 Part 3. Lastly, for degradation test, this test shall be provided for any medical devices, medical device component or material remaining within a tissue that have a potential for degradation within the human body. This test should be simulated in vitro in order to determine the rate of degradation and release of potentially toxins to estimate the exposures. This test is conducted in accordance with ISO 10993 Part 9.
Here is the main components of bioprosthetic valve. And the first component is the frame, which comprises of polymer ring PET film and a frame made of alloy alloy waveform. And the second component is the 3 independent leaflets, which made from Resilia bovine pericardial tissues. And the third component is the constructing marking aid, which aid for proper orientation for implantations. And the final component is the sewing ring, which made from polyester fabric. So here is the design consideration that need to be considered. So the valve must have durable physical properties and represent the best anatomical fit for replacements. And the valve must be able to close and open in an average once every seconds. And the valve tissue of the valve must be chemically treated and sterilized so that the tissue are compatible with the patient's immune system. For the chemical considerations, the BHV are constructed from Resilia bovine pericardium preserved with glutaraldehyde. And the new generation of these tissues are fixed with glutaraldehyde to reduce its immunogenicity and prevent calcifications. Decellularizations of BHV before implantations is to prevent structural valve degenerations. For morphological considerations, the valve do not require any lifelong warfarin therapy, which lower the thrombotic risk. And the valve is no need for lifelong blood thinning medications and do not require lifelong anticoagulations. For structural considerations, the valve must have excellent hemodynamic performance and reduce post-operative transpositic gradient, and the flexible stand post in the valve must be able to reduce tensile stress at the commissure of tissue heart valve. And the valve must have long durability and last for 10 to 15 years.